Hello, everyone. Welcome to the final session in the industry's first conference focused exclusively on dental reprocessing, sponsored by 3M. My name is Lindsay Brown with Beyond Clean, and I'm so grateful that you've shared your Friday with me. Our goal at Beyond Clean was to pull together speakers who would provide critical information on dental reprocessing because that is directly tied to patient safety in the end. A reminder to you during this session, feel free to check out the downloadable resources available to you in the resources list on the right-hand side of your screen. Dr. Carrera received her DDS in 2003 from the University of Talca, Chile. Upon completion of her dental training, she became a faculty member at the University of Talca. And in 2008, she completed her specialty in prosthodontics while working as faculty. Lois received her DDS degree from the University of Minnesota School of Dentistry. Prior to joining 3M Oral Care as a staff dentist in 2016, Lois worked for over 30 years as a general dentist. I am so excited for Dr. Carrera and Lois to round out and headline our dental conference today. Keeping patients and dental professionals safe is crucial while delivering care during these uncertain COVID-19 times. The 3M oral care experts that you'll hear from right now are taking a deep dive into topics such as the use of different mask and respirator options for dentistry and the changing regulatory landscape related to their use, fit testing, user seal checks, skin protection, and an update on respirator decontamination methods. So without further ado, I would like to welcome Lois Durst and Dr. Carola Carrera.
My name is Jody Case, and I'm part of 3M's Scientific Affairs and Education team. I want to thank Beyond Clean for this opportunity to share important information regarding respiratory protection in oral care settings. Thanks to all of you for joining today. I'm happy to introduce our speakers, Dr. Carola Carrera and Dr. Lois Durst. Dr. Carrera received her DDS degree from the University of Talca, Chile, and her PhD in oral biology from the University of Minnesota. She currently works as a senior research specialist in 3M Oral Care Solution Division. Dr. Durst received her DDS degree from the University of Minnesota School of Dentistry. Prior to joining 3M Oral Care as a staff dentist, Lois worked for over 30 years as a general dentist, owning a family practice in Stillwater, Minnesota, with a cosmetic emphasis. This presentation is based on U.S. country requirements. Please always consult user instructions and follow local laws and regulations. Requirements can change in the future and are current as of this date. Digital recording or reproduction is strictly prohibited without permission. Now I'd like to welcome our first presenter, Dr. Carrera, to begin the presentation.
Thank you, Jody, and again, welcome to our webinar. Today, we will be talking on respiratory protection, and this is the agenda. So we will be providing an overview on masks and respirators, fit testing and user seal check, imported respirators, and then we will move on to decontamination of respirators and skin safety. So to kick it off, I always like to pose the question, why do we need respiratory protection? And for sure, the COVID-19 pandemic has brought relevance to this topic more than ever. And as many of you know, there are several procedures in a dental office that can create aerosol and spatter, including the use of low and high-speed handpieces, air water syringes, lasers, and ultrasonic scalers, as well as other activities in the office that can generate dust or fumes, such as cleaning and disinfection, device reprocessing, and laboratory work. Now, from studies, we know that the use of high-speed handpieces and the use of ultrasonic scalers are the procedures that generate the highest levels of aerosols and potential airborne contamination. So this is just a reminder that whenever we are using a high-speed handpiece or an ultrasonic scaler in that patient's mouth, there will be spatter and aerosol generation. Spatter, it's been defined as those particles that are larger than 50 microns, whereas aerosols are defined as those particles less than 50 microns. And those can be droplets or droplet nuclei, depending on size. The droplet nuclei are very small particles, less than 5 microns, and they are formed when those larger droplets lose water. In general, both spatter and aerosol will contain water, saliva, and the debris from the sites that you are working on, as well as microbes and their metabolites. Spatter and aerosol in particular can travel short distances, and they may remain suspended in the air, but only for a short period of time. They are in general considered heavy particles that ultimately will be deposited in those nearby surfaces, such as your bracket, your PPE, or your computer counter if it is nearby. Droplet nuclei, on the other hand, can remain suspended in the air for longer periods of time. These droplet nuclei can become airborne and travel longer distances. So, for example, if you do a procedure in room 1 that has aerosolized an infectious agent and has become airborne, those particles have the potential to travel to room 2 and could infect someone there. This is what is called airborne transmission and is well known for some diseases such as measles. Now, the relative contribution of the airborne transmission for COVID-19 is still debated. We know that it contributes to infection, but we know also that the major transmission mode is through droplets. That being said, the CDC called early on this, and they recommended to implement respiratory protection precautions whenever an aerosol generating procedure takes place in the office. So let's move now to provide an overview of different protection options. So there are many different options that can help to protect us, and the variety of those options may differ based on different factors such as the materials, testing, performance characteristics, and intended use. On the left, you will see the standard procedural masks that are meant to be single-use, disposable, and simple masks that are used to cover a person's nose and mouth. Next to that, we see surgical masks, which have the same characteristics to the standard procedural mask, but they do have an element of fluid resistance. And this is what we usually use in dentistry. The next picture shows filtering face piece respirators, also known as FFRs, and then ones that you may be more aware about is the N95, right? And they are meant to be single-use, disposable, tight-fitting respirators that do cover the nose and mouth as well. They do come in different models and sizes, and some of them have an exhalation valve to help with breathing. Those with exhalation valves are not recommended when you need sterility in your field. And within this group, you can also see that blue respirator, that's a surgical N95, so it has that added barrier component. Moving to the next box, we see elastomeric respirators, which are reusable. They are available in half and full face piece configurations, and they do require a little bit of assembly since it includes a face piece and also the disposable filters. And then the filter need to be attached to the mask for it to provide its intended protection. And then lastly, to the far right, what you will see are the ones called powered air purifying respirators, also known as poppers. And these two are reusable devices, and they do come in a variety of head and face cover offerings. And they also require a little bit of assembly because they are multi-piece, okay? So you have the head, the face cover, tube, the battery pack, and also the belt. So let's take a look of the features of these options. So let's start with fitment. Fitment of these protective devices varies. So you will see that procedural, surgical masks, and poppers are loose fitting to the face, whereas FFRs and the elastomeric respirators have a snug fit and seal to the face. The products are designed to filter against airborne particles with at least a 95% efficiency, include FFRs, elastomeric respirators, and poppers. And the goal here is to protect the wearer from airborne particles that are present in the environment. Masks are not tested and certified to provide that respiratory protection as it is defined against that airborne hazard. Some of the respiratory protection options have the ability for parts of the assembly to be clean, which is the case of the reusable respirators and the poppers. So moving on to masking specifics. These are the ones that we are familiar with, right? But it's important to understand what's the difference between a surgical and a non-surgical or standard mask. Masks in general, either they are ear loop or tie strap, are intended to protect the work environment. This includes your patients. And they are protected from particles that are expelled by the wearer, such as saliva and mucus. Now, surgical masks have the same protective mechanism as the standard mask, but they also have a fluid barrier resistant component that helps you to reduce the chance of saliva and other body fluids from contacting mucous membrane of the nose and mouth from droplet spatter. And masks in general can be tested. So the American Society for Testing and Material Standards provide testing standards for masks. So then masks are rated on their protection level, which includes different features that you can see in the table. And those are concerning to the resistance to penetration by synthetic blood, bacteria, and particulate filtration efficiency, in addition to breathability and also flammability as shown here. And that is how you get the different ASTM levels, such as 1, 2, or 3. Now, claiming an ASTM level will require clearance by the FDA. And one thing to note is that as filtration goes up, so the higher the filtration is, the breathability is going to go down. So that's important to recall here. Now, similar comparison can be done for respirators. And all the respirators in general are intended to help protect the wearer from the environmental substances or airborne particles that are present in their work environment. But surgical respirators have that added barrier component as surgical masks. And they provide that protection in addition to the protection to airborne particles. Now, let's see how N95s work. These respirators contain filter material and are designed to form a seal with the wearer's face so that the air passes through the filter instead of around the edges of the respirator before the air is inhaled. N95s and other particulate respirators are made using a non-woven fibrous filter media to capture the airborne particles. And these fibers will crisscross to form a web of many, many layers. The particles will get trapped or captured by different mechanisms as the airstream flows through the filter. So very large particles in the airstream will settle out due to gravity on these fibers, while some other particles that are traveling faster will be trapped by impaction. So they will run into the fiber and will get caught and trapped. Then some other smaller particles will be trapped by diffusion. So these particles are pretty much like floating around the fibers, but at some point, due to probabilities, they will hit a fiber. So then they will be trapped and captured. And a very practical way of thinking of this is that we usually tend to think about filters such as coolanders, but in reality, they work more as a spider web. So basically, many, many layers of spider web. So at some point, these particles will be trapped in that spider web. And that's how N95s work and provide you that protection against airborne hazards. Respirators in the U.S. are tested and certified by the National Institute of Occupational Safety and Health, or NIOSH, and classified regarding their particulate filtration efficiency and particle type. So here you can see the different levels of filtration efficiency and also the letter denomination for the particle type. N is for non-oily particles, R is for resistant to oily particles, and P is for proof to oily particles. And this is how you get the different designations, such as N95 or a P100, for example. Here we need to consider that the particle filter filtration classification that's done by NIOSH is a different test compared to the one that is done by MAS under the ASTM standard, and it's much more rigorous. Therefore, it's not appropriate to make direct comparisons on filtration efficiency between masks and respirators. So I'm going to give you an example. If you put a mask that has been classified under the ASTM standard to have a filtration efficiency of more than 95%, if you put that mask under the NIOSH testing, that mask might be a 70% efficiency. So the efficiency actually drops because the test is more rigorous. I just want to provide you with some information regarding the required labeling for respirators. And I know that we are aware that there is fraudulent activity and counterfeit activity that is happening. So this could provide you with some tools. So for a respirator that has been tested in the US by NIOSH, you will see the NIOSH name or logo letters in the side of the respirator, also the manufacturer's name, the TC approval number, the filter designation, right? Could be an N95, could be a P100, and you will also see the model and the lot number. Now, we also are aware that mimicking labels is very sophisticated. So on top of that, we also encourage you to look at the quality of the respirators, as 3M has high quality standards. So if you see broken straps or the broken nose clip, those might be indicators that could be a counterfeit. But again, the most direct way that to know if your respirator is authentic is if you receive it through FEMA or state authority. And now I'm going to move to poppers just to give you a brief overview, because we are aware that some dental offices are actually using them. Poppers in general can offer certain benefits over the disposable respirators. So with disposable respirators, actually, the lungs of the users is the one that are doing the work to pull the air in through the filter media, right? You have it on, you are breathing in, and that's how the air is getting through the filter media. But with the poppers, there is a motor that is actually doing the breathing work for you, so you can have that more comfortable experience. They are usually composed by 4 main parts: the blower, the waste belt, the breathing tube, and the headgear. And there is also a battery that also needs to be charged. When assembled and the power is on, the blower fan will pull the air through the filter that is attached to the front of the system, and then the filter is the one that is removing the contaminant from the air. Then the filtered air, it's what is sent through the breathing tube into the headgear, and that's where the air enters that breathing zone of the user. So the poppers offer this continuous flow of air into the headgear. They do come in a variety of styles and different head top offerings, but one of the main things here to highlight is actually those head top or head coverings. They actually have clear face shield, and here's what you can see: a dentist wearing one, and you can see the face of the dentist. Now, that being said, the poppers do allow the usage of loops, but there might be some limitation in adjusting the loops. Also, these head coverings are designed to fit some facial hair, and they do not require fit testing because these are loose-fitting hoods. And another thing to mention is that these units could be cleaned, reused, or shared following the disinfection protocols of your clinics. Now, for tight-fitting respirators, there are certain requirements for use of respirators. So it's very important to consider that before use, the wearer must read and understand the user instructions provided as part of the product packaging. And in the U.S., a written respiratory program must be implemented meeting all the requirements of OSHA 29 in the section of 1910.134. And those include the need for doing medical evaluation, training, and fit testing. And the fit testing includes both the initial fit testing when you get that brand new respirators, and also an annual assessment that is done throughout the years that you are using that respirator. So let's talk a little bit more about fit testing. And this is because a requirement for a respirator to provide you that expected protection is that seal to the face, and that can be confirmed through a fit testing. And we also will be talking about the difference with a user seal check. So tight-fitting respirators are designed to have the snug fit to the face. It must seal to the wearer's face in order to provide you that expected protection. And this is required in the U.S. by OSHA. And this is what I mentioned before, but it's very important to highlight that OSHA is the one that has the enforcement jurisdiction over respirators use. And it's required an initial fit test once you get the respirator, but this also must be assessed annually, and as well as whenever a different size or style, model, or make of the respirators is used, or whenever any facial changes occur that will affect the fit with your. OSHA doesn't require the fit test administrators to be certified, just to know how to conduct a test, invalid those, recognize those invalid tests, and also properly clean and maintain the equipment that is used for that fit testing. And here we see an example of what a fit testing looks like. A fit test will, if you pass a fit test, it will confirm that the respirator can effectively seal to your face, because remember that the respirator will only provide the protection as the air passes through the filter, right? So if the air is leaking out, is passing through the edges of the respirator, it will lessen the protection. And fit testing of tight-fitting respirators like an N95 is an essential best practice, and is a regulatory requirement in the U.S. And this is very important to remember, because there have been, throughout the COVID-19 pandemic, there have been several regulatory allowances that have been issued by institutions, such as the use of FEMA-imported respirators from Asia, or distribution of non-surgical respirators from a stockpile. And in these cases, even though these are new models for us, they still require that initial phase testing as indicated by OSHA. And that will involve any employee that has a mandatory use of respirators. Now, let's look at the regulatory landscape around fit testing. And at the top of the slide, we have enforcement memorandum that have been dictated by OSHA, that again is the entity that has the enforcement jurisdiction. But at the bottom, we also have the guidance by NIOSH and the CDC. So on March 14th, OSHA issued an enforcement memorandum which permitted healthcare employers to delay the required annual fit test if the organization had conducted initial fit tests and had in trying to conduct the fit test or find the supplies, but weren't unable to locate the supplies for fit testing. So just to make clear, that the one that had allowances to be delayed, it's just the annual fit test, but not that initial fit test. That initial fit test is still required. Now, on April 8th, OSHA released another enforcement memorandum, and this I want you to pay attention to this. This one said that if a respirator manufacturers had data to support what is called fit crosswalks from one respirator model to another very similar respirator model, then OSHA will dismiss the need of conducting a fit test on that new model if that employee had already passed the fit test on the crosswalk model. And I know that this might sound a little bit confusing, but let's put an example where you are using respirator A and you pass the fit test on the respirator A, but now you are unable to locate that respirator. And you get a respirator B, but that is very similar to that A. If the company has data to ensure that those models can be crosswalk, you may waive that fit test for that new respirator. And 3M has published a technical bulletin which identifies several pairs of 3M respirators models whose fit test is predicted from each other. So that's in terms of the regulatory landscape. Now let's go to guidance. CDC and NIOSH again have only advisory roles here. They don't have enforcement or power of enforcing regulations. And most of the recommendations regarding fit test is pretty much for conserving supplies, right? So it's preferred the qualitative fit testing compared to the quantitative fit testing. And also NIOSH had some recommendations around what happens during serious outbreak conditions. So pretty much this one says that if employers find that fit testing is simply impossible, even without fit testing, a respirator will provide better protection than a face mask or not using a respirator at all, right? Now, that being said, again, NIOSH and CDC have only advisory roles and they are not empowered to enforce regulations. And here I just wanted to give you some resources that 3M has, and we will be providing on our website by the end of the webinar, but these are very good assets you can obtain more information regarding fit testing. So let's go to donning and doffing of N95 respirators. And we have a very good material on the Wear Right poster with pretty much provides you the sequence of how to don and doff a respirator. And this is very important to consider, especially for the reuse of respirators. And for that, the CDC also has very good infographics on how to do that. But basically, you need to read the instructions from the manufacturers because each model might require a slightly different sequence. But you need to read that in order to follow the sequence. Now, in terms of the use of respirators, it's not recommended that tight-fitting respirators are used with any facial hair or other condition that may prevent a good seal between the face and the edges of the respirators. So in order to maintain a good seal, all hair, hoods, or other equipment must be kept out of the respirator face seal area. And again, I will encourage you to revise our information in our website. Now, another topic that we are going to cover is the user seal check. Okay, so we talk about fit testing, and we know how that is regulated by OSHA. Now, the user seal check is something different, and it's something that you need to do every time that you don a respirator. So every time that you are putting on that respirator. And you can do it basically in two ways. One is called positive pressure, and the other one is called negative pressure. For the positive pressure one, this will involve that you cover the respirator with both hands, but without collapsing it, and you will proceed to do a sharp exhale. You should not feel leaks on the periphery of the respirator. For the negative pressure one, you will do a very similar thing. You will put your both hands without collapsing the respirator, but now you will do a sharp inhale, and you should not feel air entering the edge of the respirators. If you detect a leak, you need to relocate the respirator and try it again. But if you are unable to successfully achieve a good seal, you might need to consult with your supervisor because you may need to do fit testing again or try another model. And with that, I would like to pass it on to Dr. Lois, who is going to cover the rest of the agenda today.
So to start things off, I'm going to discuss the use of respirators from other countries. Something that has become rather confusing as dental offices are attempting to secure adequate supplies of respirators. Much of this information I present can be found at 3m.com/airlift. To address the issue of shortages of N95 respirators that our profession has encountered, the CDC, FDA, and OSHA have all announced temporary recommendation during the COVID-19 pandemic. So the CDC's report on strategies for optimizing the supply of N95 respirators recommends that healthcare institutions, including our dental offices, that no longer have access to NIOSH-approved N95 respirators, consider respirators approved under standards used in other countries that are similar to NIOSH-approved N95 respirators. The FDA has issued several temporary emergency use authorizations which address the emergency use of certain non-NIOSH-approved imported respirators by healthcare personnel in the United States, including our dental offices. And likewise, OSHA issued an enforcement memorandum on April 3rd, 2020. Specifically, it outlines enforcement discretion to permit the use of FFRs and air purifying elastomeric respirators, which are certified under certain standards of other countries or jurisdictions. In early April of this year, and continuing today, 3M reached an agreement with the U.S. government on a plan under the Defense Production Act, which enabled FEMA to import 166.5 million respirators into the U.S. over a 3-month period starting in April from 3M plants in Asia to help bolster the supply of FFRs in the United States. These imports continued into October of this year for a total of more than 228 million respirators. FEMA is distributing these respirators to state emergency management agencies, and the states determine distribution to healthcare facilities based on need. FEMA is shipping these respirators directly from 3M facilities in Asia, and these models will arrive in their Asia packaging. These respirator models hold various approvals, including, in some cases, NIOSH N95. All of these different countries' approvals incorporate testing for filtration efficiency and inhalation and exhalation resistance of the respirators. The 3M model number will be printed on the packaging and the respirator. 3M has taken steps to try to ensure that English user instructions are provided to organizations receiving these respirators, including posting user instructions for these respirators on the 3M website. So, questions to ask yourself when you receive imported respirators to ensure they are authentic and genuine 3M product include: did you receive the product directly from FEMA or from FEMA via a state authority, such as a board of dentistry? If yes, your respirators are authentic 3M product. Second question to ask is, was your organization required to pay for the product? If your answer is yes, your respirators are not the ones manufactured by 3M and imported and distributed by FEMA and may be counterfeit. 3M has been advocating with FEMA and working closely with the ADA and other distribution partners to prioritize dentistry for supply respirators. 3M is dedicated to continuing this mission. So let's dig a little deeper into more specifics of these imported respirators. First of all, many of you may be asking where are these imported respirators coming from? The supply of 3M FFRs manufactured in Asia that are being imported and distributed by FEMA are coming from many parts of Asia, including China, South Korea, and Singapore. The list of all 3M respirator models that are being cleared to be imported is quite long. They may not all be imported at this time, and perhaps some of them may never be imported, but all of these models pictured are authorized to be imported. As you can see, there are several different families of respirators. Some look very similar to ones that we have been using in our practices, such as the cup-shaped respirator in the upper right corner, and some of the other models may look unfamiliar to us, like the vertical flat style. You can see unvalved and valved KN95s as well as unvalved KN90s. It's important to understand that some of the models being imported are exactly the same as ones that are authorized to be sold in the U.S., such as the 8210 model in the upper right. Also, FEMA is importing respirators made by manufacturers other than 3M. The information that I am presenting today is specific to 3M respirators only. So when you consider the differences between all of these respirators being imported, one thing you might notice is the shape. As I mentioned on the previous slide, several of the respirator models that FEMA is acquiring and distributing have a construction called vertical flat fold, which is not usually seen in the United States. These respirators are packaged flat with a vertical fold through the middle, but open up into a cup shape, such as the mask pictured in the upper right. As these respirators are designed for people with facial features common in Asia, they may not fit us as well as respirators intended for sale and use in the United States. And lastly, these respirators may also be different colors than ones that you're used to seeing. They may be white, gray, or maybe even blue. An example of a gray one is pictured on the bottom right of the screen. Now let's talk about the similarities among these different imported respirators. Like the cup style and the horizontal flat folds that are usually sold in the U.S., these imported models with vertical flat folds have two bands and a metal nose clip. The nose clip is folded in half at the top of the facepiece. The first step in putting on these respirators is to open the facepiece into a cup shape. After that, the donning or putting on the respirator follows steps similar to those for the cup style and horizontal flat fold style as Corolla reviewed. Because these respirators may not fit the same as respirators intended for sale and use in the United States, users must be fit tested before use. And lastly, some FEMA imported respirator models are the same as models that are common in the United States but will be in packaging with Asian languages. It is very important to understand that if a fit test cannot be conducted or the wearer cannot pass a fit test, then these products should be used as a face mask, not a respirator. I would like to take a moment to discuss a specific type of imported respirator with ear loops, as this feature is quite different from ones that we see in the U.S., and they may attract some questions from you. So in the U.S., ear loops are not found on NIOSH-approved respirators. NIOSH-approved respirators all have two headbands, one that goes around the crown of your head in the back, and the other band goes around the back of your neck. However, these ear loops are present on some certified respirators made by 3M outside of the U.S., such as the KN95 respirators that you may receive from FEMA. Of course, I've said this many times, but a fit test is still required with these models, and all wearers must achieve an acceptable fit. Another thing that we've gotten a lot of questions regarding is the difference between KN95s and the KN90s. So let's take a closer look at that. If you remember, the CDC has made a list of global certifications for respirators equivalent to N95s that can be used in place of N95s as part of a crisis capacity strategy during this time of COVID-19. OSHA has also made a list of global approvals that can be used in place of N95s in times of shortages. Remember, N95s are approved in the U.S. by NIOSH. KN95 is a respirator performance class which is approved in China and considered similar to the N95. As you can see from this chart, both the N95 and the KN95 have assigned protection factors of 10 in their respective countries, and both of them are required to have at least a 95% filtration efficiency as part of their performance qualifications in their countries. Both the N95 and KN95 have been recommended by their governments to be used during the COVID-19 response. So the FDA authorized KN95 respirators can be used by healthcare professionals in the U.S. as recommended by the CDC at this time. Now looking at the KN90s, We see that this performance class is also approved by China and also has an APF of 10. However, the main difference is that the required filtration efficiency is only 90%, which is lower than the 95% found in N95s and KN95s. Because of this, the KN90 has not been recommended on any of the lists mentioned for global approval similar enough to use in place of N95s. So for this reason, KN90 should not be used for respiratory protection, but only can be used as face masks or isolation masks. The KN90 models thus do not need to be fit tested when used as a face mask. Before moving on, let's review some of the general reminders on respirators. Individuals using respiratory protection should always carefully read and follow the user instructions for the model of respirator they are using. Secondly, it's very important that the user be clean-shaven, as Carola mentioned, otherwise you will not get an adequate seal. You also need to follow the donning instructions exactly to get a good seal between the respirator and your face. If you do not have a proper fit to the face, you will not get the expected protection from the respirator. And finally, again, training and fit testing must be done with each new respirator model, and a user seal check should be done each time you don the respirator. All right, now let's talk about a topic which we have received many questions about also, the decontamination of respirators. We all know that during this COVID-19 pandemic, many healthcare institutions, including dental offices, are experiencing shortages of N95 respirators. The CDC has issued a document called Strategies for Optimizing the Supply of N95 Respirators. In this document, the CDC makes recommendations based on conventional, contingency, and crisis capacity strategies. Contingency and crisis strategies are utilized when conventional strategies are not adequate and include things such as the use of N95s past their shelf life, the extended use of N95s, meaning using one respirator for multiple patient interactions, the use of other types of respirators, the use of respirators from other countries, and the reuse of respirators, which means using one respirator for multiple donnings or multiple days. Please note that decontamination and subsequent reuse of respirators should only be practiced as a crisis capacity strategy and as a last possible resort. The CDC has created several documents on extended use and reuse of respirators and has published guidance on the decontamination and reuse of respirators. According to the CDC, research indicates the virus SARS-CoV-2 survives for up to 72 hours on a variety of surfaces. Therefore, the CDC is recommending a wait and reuse approach before consideration of other decontamination approaches. The wait and reuse strategy involves issuing 5 respirators to each dental healthcare worker. The healthcare worker will wear 1 respirator each day and store it in a breathable paper bag at the end of each shift. The order of respirator use should be repeated with a minimum of 5 days between each respirator use. This will result in each worker requiring a minimum of 5 respirators, providing that they inspect, put on, take off, care for them, and store them properly each day. Healthcare workers should treat their respirators as though they are still contaminated, even if beyond 72 hours, and follow the precautions outlined in CDC's reuse recommendations. Before each use and reuse, respirators should be inspected carefully for signs of damage, wear, fatigue, or soiling. It is important to know that if a respirator has been damaged or appears worn or soiled, the respirator should be thrown away and a new one used. If your supplies are even more constrained and 5 respirators are not available for each worker who needs them, then this might be a time that respirator decontamination may be considered. Regarding the decontamination of respirators, an effective decontamination method should reduce the pathogen load, maintain the function of the respirator, and present no residual chemical hazard for the wearer. Decontamination might cause poor fit, decreased filtration efficiency, and decreased breathability as a result of changes to the filtering material, the straps and nose bridge material, or strap attachments of the FFR. Per the CDC guidelines, a number of sterilization companies are assessing decontamination processes for N95 respirators. The FDA has granted some emergency use authorizations for several decontamination systems during the COVID-19 outbreak. 3M is collaborating with several sterilization companies and institutions which are investigating ways to safely decontaminate 3M's N95 respirators in line with the CDC guidance. In 3M's work with external manufacturers of sterilization decontamination equipment, 3M relies upon those developers to confirm the germicidal efficacy of the method and to provide information on potential hazards to the respirator user. It is important to know that 3M evaluates the effect of the particular decontamination method only as it applies to the filtration efficiency and integrity of our respirators, not their efficacy with regards to deactivation of the virus that causes COVID-19. Methods currently under evaluation include vaporized hydrogen peroxide, UV light, and low temperature moist heat, amongst others, as reflected in the CDC guidance. So recall again from Carolla's presentation that a respirator can only work when air passes through the filter. Air will take the path of least resistance, so if the seal isn't there due to damage caused by the decontamination method, the air will go around rather than through the respirator and therefore lessen the protection. If as a result of decontaminating a respirator, the filtration is damaged or the respirator does not fit, it will not help reduce exposure to airborne particles at the level indicated, such as N95. So details in this very busy table represent completed testing done by 3M, evaluating the filtration efficiency and integrity of certain decontaminated 3M respirators where emergency use authorizations have been issued by the FDA. While you can see that vaporized hydrogen peroxide decontamination methods by several different companies have passed 3M's testing for different respirator models, these methods really have more implications for larger healthcare settings like hospitals. However, I would encourage you to check with these listed manufacturers to see if they have added any dental applications. There are other decontamination methods that have passed 3M's filtration efficiency and fit evaluations for certain 3M respiratory models, but they do not have an FDA emergency use authorization at this time. This includes companies using vaporized hydrogen peroxide, using ultraviolet lights, which I'm sure many of you have heard about, and utilizing moist heat. This information, though, as I mentioned, changes very often, and we recommend you read the 3M technical bulletin called Decontamination Methods for 3M N95 Respirators, as this is updated as new information is received and/or additional testing is completed. It is important to also know that there are several decontamination methods of 3M N95 respirators that 3M does not recommend, some of which you may be seeing advertised on social media or in certain dental websites. These include the use of ethylene oxide due to significant concerns associated with the potential for repeat inhalation exposure to ethylene oxide residuals, which are a known human carcinogen. Ethylene oxide is an accepted sterilant for many device types. However, given that the respirator we wear is directly in line with our breathing zone, it is not recommended for respiratory decontamination. The use of ionizing radiation is also not recommended due to degradation in filter performance. 3M also does not recommend the use of microwave due to melting of the respirator near the metal components by the nose clips, resulting in a compromised fit. 3M also does not recommend the use of high temperature, autoclave, steam, ethanol, and other solutions listed due to significant filter degradation. Lastly, ozone is also not recommended due to degradation of the headband and nose foam materials. 3M does anticipate, though, that additional information will be available as this work is completed and reviewed with regulatory agencies. All right, now we're going to go on a different topic, skin safety. In this section, I'm going to be talking about some factors that can contribute to skin injury while we wear our tight-fitting respirators, and some strategies for prevention with 2 skincare products made by 3M. While we may in dentistry be familiar with some skin issues like maybe a contact dermatitis associated with wearing gloves, or skin irritation from our glasses or loupes, we now need to understand skin safety as it relates to continued long-term use of tight-fitting respirators such as N95s. I know that I certainly have noticed issues with my own skin while wearing N95s. This information is provided, by the way, by our colleagues in the Medical Solutions Division. I've included their website on this slide in case you would like more information on skin conditions than I will provide today. Let's begin by discussing some anatomical considerations when we wear respirators or masks. Over many parts of the body, there is subcutaneous tissue, or fat, which has an important function to act as a cushion and a shock absorber for mechanical forces like pressure and shear. The lack of fat over the facial structures such as the forehead, the bridge of the nose, the cheeks, and even the ears makes these areas particularly vulnerable to pressure injuries. A number of key factors that can contribute to skin injury under personal protective equipment, most notably mechanical forces. So pressure is a mechanical force that creates injury by loading skin and soft tissue. And we understand that the primary mechanism of injury is by deformation of our soft tissue. This in turn leads to a cellular deformation and ultimately can create damage to the cell structure and eventually lead to the damage we see in skin. The extent of tissue damage, as in the event of a pressure injury, is variable, ranging from erythema, let's say, which is a superficial reddening with the epidermis still intact, to potentially a deep, full-thickness wound extending to the bone. I'm sure many of you have seen pictures on TV of healthcare workers with such injuries. The severity of a pressure injury is not only influenced by the amount of tissue loading, the amount of deformation, and the amount and duration of pressure, but is also related to individual tissue tolerance. There are a number of factors at work. For more information on pressure injuries, visit the National Pressure Injury Advisory Panel website at npiap.org. Again, that's npiap.org. Another mechanical force that can cause damage is friction. If you remember back to physics, friction happens because of the resistance of one object against another. It is dependent on the properties of those objects, and in this case involves skin and our PPE that we wear on our face. Skin damage can happen when you have continuous or repetitive sliding or rubbing of these items. Friction injury typically manifests itself as erythema or superficial abrasions. Friction is really a superficial force that does not cause deformation of tissue. Shear strain, on the other hand, is a mechanical force that acts parallel to the skin and does cause deformation of tissues. This deformation can contribute significantly to the development of a pressure injury on your face. This can be a bit confusing, but it's important to understand that friction is necessary for shear to deform tissue. If you can minimize friction, you have the ability to minimize or eliminate damage from shear strain while wearing a tight-fitting respirator. Another factor that we want to consider is the presence of excessive moisture on the skin. Skin really likes to be dry. Not excessively dry, but dry. When skin is excessively hydrated, like when we sweat, we see significant changes in skin structure and the function of the mask or respirator we are using. So in a normal situation, without any PPE on our face, moisture on our skin readily evaporates. But with PPE on, you see an increase in skin surface temperature, leading to increased wetness, and the normal evaporation is limited and the wetness increases. With an increase in wetness, you see a decrease in the skin breaking strength and an increase in frictional forces. So this vicious cycle increases the likelihood of skin breakdown underneath your respirator. So let's move on and discuss some of the strategies that can be used to prevent skin damage when we wear a tight-fitting respirator. First, you want to pick a respirator that fits you comfortably. As you don the respirator, it's really important to not over-tighten it. You might think that tighter might be better, but actually too much tightness can interfere with the seal and can increase the risk of skin injury. Next, adjust the headbands so they are in the correct position. You don't want the headbands to rest on your ears, for example. And of course, you do not want to ignore any discomfort or pain under any protective equipment. This is a warning signal of potential skin damage. And obviously, as soon as you can get away from the patient care area, you want to remove the PPE and relieve that pressure and friction on your face. Of course, following your facility infection control precautions for doing so, and making sure you're redoing the seal test when you replace the respirator. And finally, you want to protect the skin from moisture and friction. And many of us know that it can get really hot under the N95 respirators if you wear them for a long period of time. So let's talk about options if you do have some skin changes from wearing tight-fitting respirators. It is important to remember that fit and seal of the respirator is the primary concern for your protection. There is a lot of information on social media and various websites recommending the use of different wound and skincare products, and a lot of it does not consider the impact on your seal of the respirator. If you feel you should wear a dressing or a bandage over an area of skin injury, the thinnest, most low-profile dressing available should be selected. Once a dressing has been applied, a fit test should be performed. I also want to address the use of common skincare products such as creams and ointments, which sit on the surface of our skin. In addition to interfering with the seal of your respirator, they can also cause the respirator to slip and slide, which of course results in no seal and possible friction. The bottom line is if a product is being recommended for use under a respirator, please ask the manufacturer for their data showing that the seal of the respirator is maintained with that particular product. The National Pressure Injury Advisory Panel suggests the application of a liquid barrier film or skin protectant to help prevent skin damage from friction and moisture. 3M actually is in the unique position of being both a manufacturer and developer of skincare products and respirators. We did fit testing on 2 of our polymer-based skin protectant products, Kevlar No Sting Barrier Film and Kevlar Advanced Skin Protectant. This testing showed that both of these products can be used under 3M N95 respirators without interfering with the seal. I'd like to take just a little bit of time to talk specifically about these products, as again, they are pretty new to dentistry. The first product I'd like to discuss is a Kevlar No Sting Barrier Film. It's an alcohol-free liquid barrier film intended to protect skin from bodily fluids, adhesives, and friction. So, obviously it's very well suited to protect our skin under a tight-fitting respirator. And to use this product, you can either use the wipe or the wand applicator. You need to apply this onto dry skin, and you put it any area where your respirator is likely to cause friction or be tight, as shown in the pictures. But you should not use it around the eye or the eyelid. We want you to make sure this product dries completely, which takes maybe about 90 seconds. And ideally, you should be starting with a once daily application. If you notice a buildup of this product, you certainly can decrease the frequency of the application to maybe 3 times a week. And you don't need to remove this product, but if you want to, Kevlar no-sting barrier film can be removed with a medical grade adhesive remover. Our next product, the Kevlar Advanced Skin Protectant, is another polymer-based liquid product used to protect the skin when there are already areas of superficial skin damage or abrasion. We use it to protect against additional damage to these areas already damaged. So again, let's quickly review how to use it. Again, it has an applicator that you can use to apply to your face in those areas that we talked about previously. Again, avoiding the eye or the eyelid. And with this product especially, it should be applied in a thin layer. Definitely more is not better. Similar to the Kevlar no-sting barrier film, the product should be allowed to dry for at least 90 seconds before donning your PPE. And because this product is more durable than the Kevlar no-sting barrier film, we recommend starting not daily, but maybe 2 to 3 times per week. And if you notice that a buildup occurs, you certainly can decrease the frequency again to maybe 1 to 2 times per week. And similar to the Kevlar no-sting barrier film, this product does not require removal. But if you want to remove it from your skin, you can use a medical adhesive remover containing a silicone. And finally, I want to emphasize that if you do develop a full thickness pressure injury, please seek help from a wound care specialist. Well, we've now come to the end of the presentation. Along with Carola, I want to thank you so much for your attention today and for your time. And I also want to thank you for everything that all of you do for our profession. I'm going to give it back to Jody now.
Thank you, Carola and Lois, for sharing your knowledge today. We want to recognize that you and your teams, we are here to help. We are also happy to ensure proper follow-up individually with questions you may have following this webinar. You can visit our website shown on the screen or reach out to your local 3M team or call the 800 number listed. If your preference is to navigate for answers on your own, please visit the website www.3m.com/coronavirus, where you'll find a tremendous amount of resources and videos. Thank you for your time and attention today.
All right, Lois and Carola, thank you so much for that engaging, informative, important information to protect our healthcare workers in the dental space and in the healthcare hospital space as well. Everyone, we made it. You did it. You stuck it out for an entire Friday, full-on virtual conference, and I am grateful to you. Thank you again to all of our presenters today. Although we don't have time for questions right now, if you have specific questions, you can send Carola and Lois an email directly. Their contact information is in the speaker bio tool on the right-hand side of your page. Also, if you enter your question in the Q&A box on the left-hand side of your page, I will be sure to send all questions directly to them. A special thank you to 3M for their part in making today's event possible. As we close, I'd like to recognize all the professionals who contribute to safe reprocessing of dental surgical instruments across the globe every single day. For all of you who chose to spend the day educating yourself, I thank you for your dedication to your professional development and best practice. At this session's close, you will be directed to the Beyond Clean virtual conference and webinar credit hub website, where you can access the conference survey and directly download your CE certificate for 7 CEs. All of today's sessions are now on demand, so you can share them, you can reference them, you can access the downloadable resources whenever and wherever it's convenient for you. Stay safe out there, sterile processing. Stay safe out there, dental industry. Thank you for brushing up on quality with me today. And as always, keep fighting dirty. We'll see you next time.